The conveners of this meeting is PACFaH, and PACFaH stands for Partnership on Advocacy for Child and Family Health. It is a unique mix, a coalition of 8 indigenous CSOs formed in 2014, with government's awareness on the need for appropriate care for children and the family. And it is doing that, by making government to meet up with their political, budgetary, and administrative commitments. Government people cannot on their own, actualize issues concerning development without partnering with the citizens and their civil organizations. We are interested because we are expecting that it should be an all-inclusive activity. We should be involved from the inception of the budgeting in the ministries until the hearing process. Because at the hearing point, the proposals have been made. It is left for them to endorse.
A key part for us to bear in mind in looking deeply at the budget is what should we be expecting? What should we be using as benchmark? So I'm saying that with the total expenditure expected to be between 4 and 5%, our first test will be what's our gross domestic product. So if we are having a budget, it should be speaking to those things that will help to achieve this.
In budget, the citizens, the civil society must participate from A to D. Because what has been happening is simply that people or government or we are budgeting for frivolities.
We are here to look at problem solving in terms of budget, see what we can do to improve on the current 2016 budget. There are a lot of work we can do, but if we have to do that work, it means like we will start yesterday, not even today. Otherwise, is it March 25th? March 25th is when they will pass the budget. So we don't have 1 month. We probably have a week or 2. I'm happy that people are now also thinking, what about 2017? If we are going to influence 2017 budget to be better, we also have to start now.
The role for Group 3 is advocating for adequate funding in the context of deficit financing. The best arguments for the health sector advocate. When funding is not available and is not sufficient, the issues of child and family health should be prioritized. So the advocacy messages we developed is, one, we observed that in 2015, the Ministry of Health returned some funds at the end of the year. So we are asking questions that if they were actually complaining there was not sufficient funds to carry out some of their programs, how then did they return funds? So unallocated funds from TSA can be channeled to child and family health as well, to capture nutrition, family planning, routine immunization, and childhood killer diseases.
We were tasked with working on Group 1, which is prospects and opportunities for domestic mobilizing for health financing of the 2016 budget. We have 2 recommendations, and that is that the total annual spending allocated to healthcare should be increased from 5% to 10% on the 1% consolidated revenue and the basic health fund. We believe that this should be included as a budget item in the 2016 budget, in line with the National Health Act that has been gazetted. We believe that there should be systems put in place for basket funding and for a trust fund, a healthcare trust fund that multi-donor agencies can put in funds into. Parties, CSR, private sector, well-meaning Nigerians can put in some funding into that will be directed towards universal health coverage in Nigeria and towards the financing the budget.
Federal government compliance with inherited and new international obligations in the health sector, the benefits and challenges. So, the family planning for the London 2012 summit, the government made a commitment of 3 million before the conference and 8.35 million during the conference, which makes a total of $11.35 million. The Sustainable Development Goals, particularly goal number 3, which talk about health and well-being. Target number 3.6 talks about substantially increasing the funding of the health services. So the word there is subjective. Nigeria needs to determine what it means to have substantial allocation.
The scope of our work was to develop the best strategies CSOs can adopt in supporting MDAs in budget implementation to ensure accountability and transparency. To put it in a simple term, is to ensure that funds in budget are available on time, used as planned, and has the needed impact. So just to set a context, budget is divided, as we know, into formulation, approval, implementation, and audit. And it's important that CSOs should get all these different phases of the budget. And all these phases of the budget should also be tracked. So it's not just the tracking should start from formulation up to approval at the National Assembly to the point it's implemented at the MDAs, and even at the end when they should submit their audit reports.
What we did in our group was to categorize our presentation according to, we took the media first of all, and we felt, the media cluster felt that they have to start at inception, because we're talking about being involved in future budgets and having a voice. And they also identify that you have the traditional media and the new media, that the new media is the social media, and they cannot be ignored.
This is a wonderful work we've done, but there's one gap. Because we are looking for voice for health, is it not? So that voice can drive the budgeting, which is a component of what we're talking about. I think we have to think on how to connect people of faith. People of faith. And I must tell you that this National Health Act got passed is because we connected with people of faith.